Hi, I'm Angela. I'm from Shillong. I'm here today to tell the stories about my experience regarding this sickness of mine, along with the treatment which I got it from this hospital. Earlier, at the beginning when I developed this sickness, I did not know that I am a cancer patient. Initially in my hometown, when I went to the doctor, when I developed a little bit of breathing problem, sore throat, cough, then I was told by some of the doctors like ENT and MD specialists and all, told me that I have some problem on my throat, that is throat infection. This way I had suffered almost for 2 years, of which when slowly it started giving the trouble more and more on breathing, which I had to really struggle while walking, especially climbing up the stairs, getting down, and then while talking. I kept developed cough, and then slowly I started bleeding also, little by little. Then I went on through the CT scan. Then after that I went for broncho, and then there they found out that I am suffering from cancer, which is the initial second stage in my windpipe.
Her complaints were difficulty in breathing on climbing stairs or doing heavy household work, and she also had episodes of bleeding while coughing. So she went to a chest physician for these complaints. Her lungs were normal, but they found a mass in the windpipe or trachea of her neck region. So they consulted me. I reviewed the CT scan and bronchoscopy findings, and I found that there was a huge tumor in the trachea or windpipe of the patient, and it was actually occupying more than 90% of the lumen of the trachea. That was the reason for her breathlessness or difficulty in breathing. Now, these type of tumors of the trachea, they are very uncommon, but when they happen, it is mainly because of the cancer. So we did a biopsy in which we took a small piece of the tumor. We sent it for examination, and as expected, it turned out to be a cancer. It was adenoid cystic carcinoma of the trachea, which is a very slow growing cancer. And treatment of this type of tumor is surgery.
And there I was devastated, thinking that what will I do? I was really scared, panic, and I was not ready even to tell at home to my family members, because I myself only, I was so scared, I didn't know how to tell them. I really took time to talk to them.
And when she came back after a period of about 3 to 4 weeks, her symptoms had increased in severity. Now she was restless even at rest. She was having breathing difficulty even when she was not doing heavy household work. So we prepared her for surgery. I operated her, and during the surgery, it was a tracheal tumor as expected. It was involving the tracheal cartilages. During surgery, I removed a portion of the trachea along with the tumor and sutured it back to the remaining trachea. Her recovery was excellent. There was no more breathing difficulty. She was eating normally. She was walking normally. We kept her under observation for a period of about 5 to 6 days, and then we discharged her. Her tumor had came out very well, so she did not require any other treatment. There was no need for giving radiotherapy or chemotherapy to her.
So finally, I came here in the month of March, and I was operated by Dr. Shilpi Sharma. And now I am sitting here as an ordinary person, general person, very well-to-do person who is not sick at all. Nobody can find me that I am sick. I am very much thankful to this hospital, especially Dr. Shilpi Sharma and Dr. Shiva, who had really treated me so well that they are equivalent for me like God.
At 2 months of post-surgery, we did a bronchoscopy just to see whether everything is in place or no, and it was healing well. Now she is under regular follow-up. She has to come and see me every 3 months for initial period of 2-3 years, and then gradually as the time increases, we will increase the duration of follow-up. She is doing well.
So actually here, why I came and say this also, it's just because I wanted to give a message to those who think that initially, oh, this is a problem, small problem, which I also suffered the same. Small problem will go on like this, it's okay, we will go this way only, it will be cured, it's better you don't do it. The early you find the symptoms, it's better you go to the doctor and consult it and just go and do. Don't be scared of this sickness, because even this sickness can be cured. It's not the end of the life.